The first report into COVID is now out, and it concludes that the UK was not adequately prepared for a pandemic like COVID-19, a situation exacerbated by disorganisation, austerity, and political distractions like Brexit. And key ministers, for example, Matt Hancock and Jeremy Hunt, faced criticism for their own roles in these failures and for the disastrous nonsense with PPE. I think there are some key points that can be made. First of all, that the preparation and the management was chaotic. The UK was unprepared for the pandemic, largely due to a focus on influenza rather than a coronavirus. No single person or department had overall responsibility for preparedness, leading to disorganisation and what the committee, what the findings have called a bowl of spaghetti. And the key planning exercises like Operation Cygnus identified weaknesses but were not adequately communicated or addressed, particularly in social care. Secondly, there was the impact of austerity, which significantly weakened the NHS and the public health services. Public Health England faced a 40% budget cut overall, reducing its ability to handle the pandemic. A 40% cut, and though the report doesn't specify it, and an engorgement of bureaucracy. Former Prime Minister David Cameron and Chancellor George Osborne defended austerity, but many witnesses criticised it for leaving the healthcare under-resourced. The political distractions of Brexit diverted resources and attention from pandemic planning, and nearly 20 pandemic planning work streams were cancelled or delayed because of this introspection. Matt Hancock, the former health secretary, argued that Brexit preparations ensured medical supply chains, while others, including the former cabinet minister Michael Gove, claimed it improved departmental cooperation. It's just rhetoric over reality. We can see very clearly the failures. The government failed to act on recommendations from past exercises such as Exercise Alice, which simulated an MERS outbreak, and there was an over-reliance on vaccines and antivirals suitable for influenza, but not for something like COVID-19. Jeremy Hunt highlighted the UK's failure to adopt effective test, trace and quarantine systems used successfully in countries like Taiwan and South Korea, and not to implement them fast enough. The initial wave of COVID-19 was more effectively managed in those countries due to their targeted measures and established border controls, which we could have implemented very easily, but Boris dithered. Moving forward, the report is suggesting that we should establish a single accountable authority for pandemic preparedness to streamline coordination and response efforts. We should improve communication and the implementation of findings from pandemic exercises to all relevant sectors, especially social care. We should reinvest in the NHS and public health infrastructure to address resource shortages, including increasing the number of doctors, nurses, beds, ventilators, and reverse the budget cuts to public health agencies to enhance their capability to respond to future health crises. We need to balance political priorities to ensure ongoing pandemic preparedness is not compromised by other national issues like Brexit. And we must ensure that planning for multiple types of pandemics, including coronaviruses, is included in future preparedness exercises. The implementation and maintenance of robust test, trace and quarantine systems similar to those in other countries needs to be put in place, and we need to develop a pandemic treaty across Europe, particularly to facilitate global cooperation. If it can go beyond Europe, much better. Data sharing, resource distribution to combat future outbreaks collectively, rather than to try and go it alone. We need to treat pandemic preparedness like counter-terrorism, focusing on gathering intelligence on global diseases and preemptive measures. This is more important than getting embroiled in conspiracy theories about where the coronavirus came from. We need to collaborate with international partners to enhance global surveillance and ensure our capability is at its very top notch in response. And moving forward, we need to establish centralized responsibility. We need to be reinvesting in public health. We need to be adopting and promoting the best global practices, implementing proactive intelligence measures to ensure better preparedness for future pandemics. But Matt Hancock and Jeremy Hunt don't come out of this looking good. But why would they? And Gove tries his very best to look important. But he is a fly to be stamped on. In the end, this is about the inadequacy of the last government and the distraction of Brexit in the face of a serious problem that wasn't seriously addressed.